information and discussion experiences by our affiliates. No? So we will be hearing from Indonesia, we will be hearing from Singapore, Thailand, Malaysia, Philippines, and of course, both in the areas of the challenges and difficulties, at the same time, how the unions responded and the government responded as well. And we look at how we can move forward from these lessons that we will be learning today from firsthand from our resource persons. So we will also try to look at how ILO will be able to present its perspective, especially on the back to better normal. And hopefully that from this, from their presentation, we can learn and we can move forward from this current situation we are in. A lot of consultation process, especially from the trade unions, have not been conducted by governments or from other stakeholders, enable for us to be part of the process wherein we can also share our stand and our position in any of the government's action or response. So we will also look at that by learning the sharing of our affiliates from 3 countries. So without further ado, I would like to welcome our first speaker. I think we will be getting it on time, and our first speaker will be speaking about the impacts and challenges brought about by the COVID-19 pandemic. So there will be 3 countries, but I will have Indonesia first, then Malaysia, then Philippines. So our first resource person will be Pa Conchoro. He's the NCC chair. Is the president as well of the Indonesia Power Union in based in Jakarta. So before I call on Pa Conchoro, I would like to request our participants to switch to English channel so that we can listen in English, because he will be speaking in Bahasa. So can we switch to English now by pressing interpretation and click English, please?
COVID, pandemi COVID, satu, para serikat berkoordinasi dengan perusahaan supaya keselamatan pekerja diutamakan. Misalnya menyiapkan alat pelindung diri seperti masker, hand sanitizer, dan alat pengaman lainnya. Dan pengaturan pola kerja sesuai dengan kondisi masing-masing wilayah. Kedua, kegiatan serikat yaitu solidaritas antar afiliasi PSI dan bantuan ke masyarakat. Solidaritas antar PSI, untuk informasi kami terkumpul kurang lebih 4.000 euro untuk teman-teman Farkes. Jangan di next dulu, Dina. Kedua, kegiatan serikat saat ini yang dilakukan oleh teman-teman afiliasi termasuk PLN Group. Satu, melalui Vicon. Aktivitinya hampir 90%. Kemudian melakukan pertemuan langsung terbatas, yaitu pertemuan langsung. Di bawah ada gambar salah satu kegiatan-kegiatan yang dilakukan oleh para serikat. Ketiga, next, Dina. Dina, next. Next. Nah, kemudian kita melakukan kegiatan webinar yang dibantu oleh Indah, Ian, dan Marlon untuk afiliasi di Indonesia. Salah satu contohnya, webinar terkait penguatan organisasi. Kemarin sudah dilakukan oleh Pak Marlon dan serikat-serikat yang ada di Indonesia yang tergabung dengan PSI. Kedua, webinar terkait isu yang berhubungan dengan pekerja. Misalnya Omnibus Law, draft undang-undang. Di dalamnya yang terkait dengan yang berhubungan dengan ketenagakerjaan dan isu ketenaga listrikan. Berikut tampilan foto-fotonya yang kami lakukan. Tujuannya apa? Untuk mengedukasi, jangan sampai dampak dari undang-undang ini tidak bisa kita mitigasi dan tidak bisa kita kritisi. Lanjut. Dina, next. Nah, kegiatan serikat afiliasi khususnya yang berhubungan dengan PLN. Satu, kami melakukan persiapan judicial review yang berhubungan dengan kelangsungan PLN sebagai public services. Kedua, sosialisasi Omnibus Law ke PLN Group dan masyarakat. Kenapa? Biar kita bisa menjelaskan dampak yang akan terjadi terkait undang-undang ini seandainya disahkan, khususnya ke tenaga kerjaan dan khususnya ke PLN sebagai public services. Ketiga, aktiviti lainnya yaitu kita melakukan pembahasan terkait hubungan industrial antara serikat dan manajemen perusahaan. Selanjutnya, kami mohon support karena kami juga melakukan press release khususnya di PLN Group terkait rancangan penolakan tentang Omnibus Law. Kami dari serikat khususnya PLN Group minta dukungan teman-teman afiliasi karena ini akan mengganggu pelayanan publik yang saat ini dikelola pemerintah dan dampaknya akan ke masyarakat luas seperti yang sudah terjadi di Filipina. Next, Dina. Terima kasih atas perhatiannya. Seandainya ada yang perlu penjelasan, oh iya, tambahan satu lagi, saat ini kita sudah bertahap masuk ke dunia kerja. Sebelum saat pandemi, kurang lebih 10% pekerja yang hadir, saat ini menuju 35% untuk yang masuk ke kantor. Sambil melihat kondisi masing-masing situasi wilayahnya. Karena setiap wilayah ada yang berstatus hijau, merah, maupun hitam. Yang hijau bisa agak longgar. Untuk yang merah masih hati-hati. Demikian kami sampaikan. Terima kasih.
Okay. Wrap up the presentation of Conchoro. I think the presentation provided some sort of already a trade union response and some of the activities in Indonesia, which may be probably be better to put into the on the trade union and the government response later on the discussion. Okay, so hopefully that we won't be having problems now with regards to the interpretation with the next speaker. No, so by the way, I will only entertain 3 questions after the speakers for this session have been already delivered their presentation. So yes. So next we will go ahead with Sister Nur Hayati from Malaysia, the female substitute for CISREC, who will be sharing with us the impacts and the challenges brought about by COVID-19 pandemic and Sister Noor Hayati will be speaking in English, so we will be all in one channel. But those who will be for Bahasa and for the Thai affiliates, you can switch to Russian for Bahasa and Spanish for English. For Thai, I think this will work out, no? Because the speaker is speaking in English now. So please, Sister Noor Hayati, go ahead. Morning.
Hello. Good morning, everyone. Now will be my time to present from Malaysia for our. I'm glad that history of health. Next slide, please. Okay, now the impact of COVID-19 to healthcare workers in Malaysia. Initially in January, December and January is about fear, panic, and worry of possibility of being infected, because that's the time where we start our awareness and our training for our healthcare workers on how to face this pandemic and how to protect ourselves, as well as we are able to provide care for our patient. And with the proper training in January, with the proper training and awareness to protect our healthcare workers, with the training, with the usage of PPEs and all these things, we are more confident to work, because we are direct frontliners that direct taking care of the patients, and we are also providing a screening for all the staff to make sure that they are healthy to come to work. And in somewhere in March, some of our healthcare workers started to have contracted this COVID-19. It is not because of they are taking care of the patient, but more on to because these things has already spread into the community, where we went for some went for, and also some involved with the wedding ceremonies and all that, and that is how our healthcare workers being infected. It is not as merely because of we are looking a direct care of the patient. No issue is in we contracted this disease from the patient itself. More onto our involvement in the community. And for the staff that we are do screening, the staff that is positive we admitted, and the one that is close contact will be quarantined for 14 days. And since some of our workers being quarantine, so it reduced the number of the healthcare workers that working in the hospital and also in the health clinic. So how do we overcome this factor in some areas, you know? Next slide, please. Continue, next slide, please. Hello. Okay, then when our frontliners healthcare workers start having positive in COVID, so that's the time where we start to reschedule our patients' appointment coming to the clinic and all that. Those only the patients emergency cases we attended, including the emergencies operation only that we attended to in the hospital. And also because of the strict MCO causing MVA cases reduced tremendously, therefore that also reduced the burden of working in the hospital, especially all the motor vehicle accidents, as well as head injuries patients. It reduced tremendously. And also for the rescheduled patients appointment, we call all the clinics, we call all the patients. They can only come to the hospital to collect their prescription to take their medicine. That's all, but no consultation being given during the MCO. And also the collaboration between hospitals and healthcare clinic to treat and trace our close contact. This is collaboration between hospital as well as the health clinic, including the health inspector. They are the one that go to the community to trace all the close contact and to arrange for them whether they need to be admitted, and also and so on and so forth for the treatment. And followed by that, next slide, please. Next slide, please. Okay. And then what is the challenges that we and issues that facing during this COVID, especially in the initial part? Of course, that's the time where when the number of patient increasing, and of course that will be the access to get PPE throughout Malaysia. I mean, and how are we ensure that PPE is adequate for us, because that's strict MCO and we are having difficulties in bringing in the adequate PPEs for our healthcare workers to use. And how do we offer the patients well? And also by doing so, we are preparing our own PPE with the help of supposing like occupational therapies, you know, and the rest of the services, for instance, like physio and clerical staff helping us with preparing for all these things. So we try to make sure that all the healthcare workers and inadequate PPE that they are being deprived of their right of having adequate PPEs as well as a good rest for them, you know, and together with and so on. And then another challenges for us is that for the healthcare workers, because we are the frontliners, and during the peak time, that's the challenges for us, is we have to work continuously, and meaning to say that we can't think of having off day, and you can't even go home where you will provide a place to stay. So, supposing like hostel, even I myself I did not go home for almost 6 weeks. I stayed in the hostel, and because I have to be together with my fellow nurses during this critical stage. And also during this time, last contact, last meeting, no meeting, and also we really depend on the social media, especially in Malaysia, where we're using WhatsApp for the way of communication among the union members. And another thing is, and during the restrict movement during MCO, of course, as I said, we cannot do meeting, no seminar, and also recruitment is also hold on during that time. And another thing is also what the scare of is the uncertainty of the future, and how are we going to work in the future with the new norm. and how are we going to adapt to the new norm. And how we do that, we using our social media from time to time, that even Ministry of Health also sharing the new things, new SOP and so on and so forth, using the social media, because that's the best time, that's the best to get to everybody, you know. And then we also have to facing and also have to educate our public with the new norm, whereby we really stress upon social distance, ask them to respect their time coming to the clinic for their consultation and all that, and we restrict the how many people that need come during supposing within 1 hour for that clinic, how many people can come in, you know. This is things going on, and we need to educate the public also in terms of respecting the new norm, on how to protect themselves, as well as we also need to protect our healthcare workers. And we also in the meantime, by doing that, as everybody knows, in Malaysia now it's almost back to normal, and our hospital is also back to usual business. And since people have start coming out now, and accidents start taking place, and that's the new challenge, whereby our emergency cases increasing. But we really select the paid cases, and nowadays with the reduce the number of patients, and even we also can allow to travel from Peninsular Malaysia to Sabah and Sarawak, and vice versa. So we are feeling much better now compared to earlier stage, where we feel fear, and we feel uncertainty, and but nevertheless that is also chances for us to improve, and from time to time identify problem, and also find the solution on how to overcome the situation. Because of course there's a difference between the places where, like Kuala Lumpur, Shah Alam and Putrajaya, compared to some other places in Malaysia. But thank God that now we are no more a red zone, no more, and we are all green zone. And in conclusion, I think as we all know that fight for COVID-19 is still going on, and we have to, like it or not, that we have to live and adapt to the new norm. And as you all know, also follow WHO guidelines. This is also, and also role of OSH. For us for healthcare workers, we have our established OSH department in every hospital and health clinic. And the best thing is also have two-way communication with our employer, that is Ministry of Health, and on the challenges and the difficulties that we are facing. But so far, with the cooperation among each other, I think this is fight that we must win. With that, I end my section, and I can answer any question later on. Thank you.
Okay, Sister Nurhaini, thank you very much for that very good and wonderful presentation of your Malaysia situation, especially on the challenges and the issues and the difficulties you faced, no, during this pandemic. It's a very clear and highlighted in your presentation that there are a lot of things that have been common in other countries as well, but you have made it very clear and very simple to understand. Okay, due to the time constraint, I would like to request our third speaker for this session, and I hope Brother Ray will be within 10 minutes. So Brother Ray from Philippines, he is the current NCC chair and the president of the Manila Water Supervisors Association. Brother Ray Pumar, please. Kindly unmute, please.
Hi, good morning, everyone. In solidarity,
Good morning.
uh, I'm Mr. Rinaldo P. Fumar, the president of Manila Water Supervisors Association from the water sector. My topic is about the impacts and challenges brought about by the COVID-19. In the introductory, from the pages of world history, pandemic diseases occurs for almost 100 years, since from 1720 to 1723, called the Great Plague of Marseille, which around 100,000 people died and perished. In 1770 to 1772, the so-called the Russian plague, an estimated of 100,000 people may have died that ravaged Moscow. In 1918 to 1920, the so-called Spanish flu affected 500 million and one-fifth of those died. The COVID-19, which started in the mainland of China, spread to the four corners of the world, now has a record of 12 million affected individuals globally, and 530,000 people died, and still the numbers are going up. The delay of the official declarations of pandemic from the World Health Organization causes us also the delay in our implementation regarding the restriction to travel in and out of the country by the middle of March 2020. During this period, we still accommodate tourists from China out of diplomatic respect, thus bring us this kind of discomfort. Thailand was able to contain COVID-19 by locking down their port of entry in the middle of January 2020. And they restricted the travel from the mainland in China, in which this virus firstly erupted. In the Philippines, we have, at this point in time, we have 40,000 cases of numbers of virus infected. And the numbers of recovered are almost 9,000. And the number of deaths is 1,200 as of this point in time. Then the impact brought about by COVID-19 in the Philippines. The COVID-19 greatly affected the life of every Filipino in terms of political, economic, and social condition. And the political spectrum, the liberty to travel is being suspended through the implementation of modified and general community quarantine nationwide. The freedom of association and any aspect of gatherings were prohibited. The government as a whole was paralyzed, and any transactions were suspended. In the economic perspective, it brings down the financial conditions of the country. The casual and project employees received no salaries and wages, and many were laid off because of worsening economic condition. The influx of OFW going back to the country is another story that will increase the unemployment rate. The price of commodities and other basic services rose up. The trade of commerce greatly affected, and the government budget was realigned by allocating its current budget to provide the three basic necessities and providing conditional allowance to the poorest of the poor. And the social aspect, the life of an individual will no longer be the same unless a new vaccine will be injected to all individuals. The educational system is in doom, and presently the government is in quandary in how to cope up with an alternative learning process. Traveling around the country as a local tourist is not permitted, and even in the natural destinations, and the tourism industry as one as the major source of income greatly slide down. Most of us are in the state of stress, considering that for almost 4 months, we do nothing and just staying in our home. The COVID-19 spread to the provinces, which has 0 cases, because of the implementation of Balik Provincia program and the influx of OFW to the respective provinces, which is untimely and runs counter to the enhanced community quarantine principle. In the private sector, their workers were given financial assistance during the durations of work stoppage, and they even made advances of their year-end bonuses through the intercession of the labor group. But not all workers receive this kind of assistance, especially those companies without collective bargaining agreements. Even in the public sector, they are adamant extending financial assistance to the government workers. In my company, as one of the service providers of essential services, which is water, we see to it that we could provide 24 hours of potable water supply. This is in compliance with the health protocol and as one of the agencies that plays an important role in providing health and sanitation in the households. With the suspensions of operations of big factories and industries that requires great volume of water for their production, we were able to provide adequate water to individual residences within our West Concession Service area of Metro Manila. Another, the challenges brought about by COVID-19. The factors to be considered are the following. The way of life of the individual will not return to normal unless vaccine will be available. This is a great challenge that the government should do. The cost of the vaccine is one of the factors to be considered. In our company, before we start for work, the management see to it that you undertake a rapid test. If found positive, you will subject to swab test. In the public sector, the government agencies should conduct this process and allocate budget for this vaccine. Number 3, the rising cost of commodities in the government should strictly monitor the prices in the market. Number 4, the problem of unemployment. There are, as of today, many workers, especially from the private sector, are being separated and displaced. As of this morning, I heard from the news, now almost 1,200 business enterprise will close their operation. And this could be a great challenge to the government on how to found another kind of support from the workers. Overseas Filipino workers should provide is also one of the problems of the government. You know, we have many seafarers, land-based workers scattered around the world. And now the influx is going back to the Philippines and to the provinces. So the government should provide alternative employment of our OFW and seafarers, health workers and frontliners. Assurance from the government of additional compensation, issuance of medical protected kit, health insurance, hazard pay, food allowance, and home quarters for our health workers and frontliners. This is one of the great battle of the union in the Philippines, recommending for these benefits to our health workers and frontliners. Now, because of the realignment of fund to given the basic necessities to all individual, the construction of the existing project, available project will be delayed. Financial assistance to all government workers. Hope that the government sector would fight this premise that all government workers should be given financial assistance. Involvement of private sector and labor group in the decision making. One of the great impact for labor is the labor should be represented by the union in framing up or in planning regarding all the actions to be taken regarding this pandemic scenario in our country. Imposing restriction of laws and regulations. You know, considering it's not, and Philippines is not like Thailand when they said bow they all bow. But here in the Philippines, because of our more ultra-democratic way of life, we have some individuals who are hard-headed and they don't follow instruction, just like the United States, which as of this point in time, they are now the great numbers of affected of this coronavirus 19. So that's the balance of thought between a very restricted country and an ultra-democratic country like the Philippines. Thank you.
Thank you very much, Brother Ray, for that presentation on the situation in the Philippines. So now I will be, due to the time constraint, I would only have at least 2 questions. You can raise your hands, and those 2 questions who will be able to raise their hands, I will try to accommodate you and give you time to ask questions with the this session on the sharing of challenges and difficulties brought about by the pandemic. So you can use your raise your hand app on your chat on the participants function. There's no question? Okay. So there's no one raising his or her hand to ask question to the session we just have now. So no question. Okay. So shall we go to the next session? It's already 11:02, and we try to finish this by 12:15 as we have decided. Okay. So we will try to have Sister Panyesa from the PITAC, Thailand, or from the National Nurses Union of Thailand. She will be able to share with us the union and the government response. So I think now I hope everyone who's not speaking kindly put your mic on mute, please. So Sister Panyesa, so we go. We have to switch now to English channel so that we can hear the interpretation of Sister Nat on the presentation of Sister Panyesa. So we switch to English channel now.
Yes.
Go ahead.
Hello, everyone. Good morning. I'm Panyesa Vachara Anand, General Secretary, Nurse Union of Thailand. Yes. Today, I presentation coronavirus infection in Thailand now. Those returning from abroad and undergoing detention to monitor the condition at the state provided. According to the Department of Disease Control today, there are a total of 49,458 detention cases. 236 people are found. The country with the highest rate of COVID-19 cases is Kuwait. There are 293 Thai people returning to country. 36 infected. Revenue about 12.29%, followed by Saudi Arabia. There are 224 Thais returning to Thailand. 28 of whom are infected, 10%, 0.22%. Pakistan has 196 Thai returning to Thailand. 13 are infected, 6.63%. Indonesia has 1,092 Thai returning to Thailand. 65 infected, about 5%, 5.95%. Information from the organization New Medical Relations Mission Group Office of Information Office of the Permanent Secretary. The situation of COVID-19 in Thailand today is the first day that easy fight is in effect. In the business group, pub, karaoke, bar, cruises is considered a high risk group. In many countries, the group has returned to find infection people in this group again. Ask the business owner to strictly follow the measures specified by a Ministry of Public Health in order to reduce the risk of spreading the disease, such as a spacing space, arrange screening point for age, temperature, limit number of users, clean the surface with frequent contact, such as microphone, bathroom, handrail, doorknob, open on rather 24.00 hours, and all staff must wear masks, close masks on the time. Service user request to follow preventive measures, myself sitting, standing, not more than 5 people, not sharing a spoon, a plate, a glass of water with the other, wear mask, close mask, and frequently wash hands, as well as having a registered in out through the Thaiwin, Thai Chana platform application every time. Network of nurse union in Thailand have a lot more than 30 unions. You can see picture of rate of medical staff infected COVID-19 in Thailand. I explain to you, it's the highest of nurse. Medication staff infected COVID-19. Nurse infected 41 to 58%. Doctor 19.8%. Nursing assistant, medical assistant, service 70%. Pharmacist, assistant, pharmacy staff 1.98%. Physical therapist 1.98%. Laboratory staff 0.99%. Other personnel 12.87%. It's a short Ministry of Public Health at 26 April 2019. Medical staff infected COVID top cumulative nurse 36 nursing assistants, 16 doctors, 2 dentists, 2 pharmacists, 23 others, referencing the COVID-19 Information Center from January to April 2020. The Union of Nurses of Thailand has driving together with a network of public health personnel to claim from the government as follows. From the situation of COVID-19, the Nurse Union of Nurses of Thailand have driven together with a network of public health personnel to claim from the government as follows. 1. Act to increase the compensation for it and increase the couple every service unit, such as screening people who have danger, treating those who are at risk of patient. 2. Request that the government allocate sufficient protective equipment for workers. 3. Act to issue legislation to protect the workers who are sick from the infection from work from original doubles, or if there is a death, compensation for family of 1 million baht. 4. Decentralization of government complaint center. The successful result of operatives are 1. Increased couple, compensation allowance rate. 2. There is a law protecting workers. There is a basic hearing act of public health officers who are injured. 6. Disabled or die in operating. 2. There is a civil service welfare act. 3. Packing regulation, disabled die. Admit to the Civil Service Commission of OA. Injury nurse until disabled die will have for the right select civil service. 3. The advancement of professional nurse can raise a position hospital management can promote health at the district level. 4. The government has put professional civil servant COVID-19. Performance of government during epidemics. The government employed 45,000 medical personnel consisting of 24 divisions, nurse, pharmacists, physical therapists, medical technologists, public health academic, public health officials, and others. More than 13 and 80 registered professional nurses, all of whom are employees as civil servants, provide security in return for outbreak prevention work, with no new cases emerging within the country. On July 2020, in the first round and in the second month of August, a total of about 522 people who work in the district health promote hospital. But the problem remains that could not be roaded as civil servant has to be solved further. Adaptation of nurse union further new normal. Adaptation of nurse union further in the claim that require the use of TV, electronic media, public relations via computer, mobile phone, and various communication systems in street with its countries and can prevent the infection of COVID. Nursing unions have claimed that are far away in the middle. They have adapted to COVID epidemic situation in order to be successful in their claim. The demanding issue will be resolved. There has been a revision of information delivery system of members, grouping, meeting, and communication. In the future, it must develop into a small tonic medium. Come to a health with work. Hope the union members of Asia Pacific will cooperate to fight this outbreak well. I have workers in Thailand music video for everyone. Nicole, for open for you. In Thai, has a mama for children infected COVID-19 at a tertiary hospital. And adaptation should prevent PPE for prevent COVID-19 and training nurse in hospital for fighting COVID-19 in Thai. It's a new disease. For nurse, it's difficult to prevent COVID-19. Training nurse and doctors team. Adaptation for prevent use of plastics, those It's a primary care hospital unit. It's a home care for children in Thailand. Yes. Youth network, also more volunteers, yeah, of public health. It's a 3 provinces of Thailand has a prevent COVID-19 volunteer. It's a makes a new smart. No, and not in Thailand too. It look like Indonesia and Malaysia. PPE in Thailand's adaptation. One piece about in that, and among is a presentation. Yeah. It's a donate for people. Solidarity. Thank you very much.
Okay, thank you very much, Sister Punisa. I think you have
Thank you.
shared how our union, National Union of Nurses Union of Thailand, able to cope up and address issues of nurses, especially those in the front lines and in the emergency rooms, use of PPEs and others. And I think you have also mentioned some calls to government action, and you have presented some that you possibly got from your demands from the government. I think it's one lesson that we learned, that if there are a prompt and steady support from the government with regards to the workers' rights, workers' protection, especially those in the frontline workers, the respond and the the action is more viable. Okay, now we go to the next speaker, Brother Sanjeev Tiwari from the Amalgamated Union of Public Employees in Singapore, to share their government and the union response in Singapore. Please, Brother Sanjeev.
Thank you, Ian. Let me try sharing my screen for the slides, if it's okay.
Yeah, please go ahead.
Okay, can everyone see the slides?
Yes, yes, we can see.
Right, thank you, Ian, and good morning, sisters and brothers from the PSI fraternity and our affiliated unions. Okay, I am Sanjeev Tiwari, Sistrec Co-Chair, General Secretary, Amalgamated Union of Public Employees from Singapore. Before I begin, I would like to also thank Ian and his team for organizing this webinar, and of course giving us the opportunity to speak and share Singapore experience with all of you. Okay, the novel coronavirus, or commonly known as the COVID-19, it is something that has hit and wreaked havoc across all countries across the globe. As you can see on the slides, the numbers are astounding. Over 11 million infections, 500,000 deaths, and the numbers are still coming in. And countries are actually trying their very best, or struggling to how to manage and contain this in their own respective areas in their countries and protect their citizens. COVID-19 is definitely the biggest crisis in our generation, and it has disrupted our way of life. Something that we're gonna have to adapt and try to see how we can actually live and improve the situation as we move along. Sisters and brothers, Singapore has also not been spared from the virus, and we are equally affected. From January itself, when the virus hit our shores, we actually set up an interministerial committee to try and mitigate and curb the spread within Singapore itself. The tripartite partners, unions, businesses, and of course the government actually came together in many efforts. They actually put together a lot of measures to actually prevent the spread and help Singaporeans tide over the difficult period. The efforts were actually on three fronts. One, how then can we help the economy? So most of you would have read that the government itself, in an unprecedented move, actually rolled out $100 billion budget to help Singaporeans, businesses manage the situation, tide over times like these where during lockdowns, they were prevented from working and businesses were prevented from conducting their usual businesses and making money. So all this money was actually put out to the citizens in hope, in order to actually curb and help people get over this situation as best as possible. The second front that we were actually trying to assist was workers. So one of the things that we actually got together to do was, one, to make sure that during this period, workers would have some sort of financial assistance. The unions, labor movement, NTUC, together with AUP, we actually had financial assistance rolled out for staff members who were affected by this COVID-19, displaced or were having seen a cut in their wages in that sense. The last front was actually businesses. So in totality, there was also this effort to make sure that businesses were provided with wage support, tax incentives, and rental rebates, so that they can then save cost and then help preserve jobs for our workers in that sense. So continue making sure that our people can be employed, or at least help reduce unemployment over time. If you look at it, the focus and the measures that we actually put in place was primarily to save lives in terms of making sure that the infection rates remain low or minimized, and make sure that livelihoods, jobs are protected in that sense. We have been exiting the circuit breaker from June 2nd. Singapore has taken a phased approach in trying to open up the economy and allow things to focus on returning to normalcy. Much has been spoken about public sector workers. It is a national crisis, and I have to say that our public sector workers have stepped up selflessly. And this is not only healthcare, but we are talking about the municipal workers, we are talking about transport workers, uniform services, and frontline workers who are actually deployed. In Singapore itself, during the last 4 months, we have actually seen almost close to 4,000 public officers being redeployed into new roles to become safety ambassadors, to become enforcement officers, and also to go and help out at the dormitories to prevent the infections from spreading further. In all of this, we also saw public sector workers having the need to adopt to new technologies and also new ways of working from home, using online services. They were pushed to limits, they were pushed to doing things more than the norm. The topic today was better normal, or in my opinion, the new normal. What we think as a union is that the ways of work will definitely change. As economies open up, countries slowly try to go back to normalcy, work will change. This has been seen from the lessons over the last 4 months. One, companies have seen or used technology, and they realize that it has been benefiting them as well. So there will be acceleration in the use of technology and digitalization. We will also see unemployment and loss of jobs and functions, primarily because companies will realize that they can do things in a new way, or that certain routine and mundane functions can be automated. Hence, we're going to see our people being affected. This is not only applicable to the private sector, but public sector workers as well will definitely need to upskill and reskill. Because of the technology use, because of digitalization, we will definitely see workers needing to know new skills, using new machines, and upgrading their processes. Hence, the skills that we need to make sure for the skills for tomorrow needs to be trained into our workers itself. The unions would also need to help workers transit into new jobs and new roles as the economy and the world evolves. We will see companies hiring globally because they are now able to work from home or hire cross borders. This will then again have effect on our workers itself. Lastly, I also, in AUP's context, we definitely see there will be effects on union membership because the traditional sense of representation of our workers is in a physical context. Today, in the new environment, we will see challenges in representing our workers who will now be probably doing things online. The hierarchy or the physical structures will now differ. Hence, we also would need to think about how then can we then properly represent these workers in the new environment, in the new roles that they will be performing in that sense. As I conclude, sisters and brothers, I just want to share that the future is actually filled with uncertainties. And what I think will be very important in this crisis or in these times as we open up slowly and try to return to things is the solidarity in our objectives. Solidarity is not only among the unions, among the members, but I think the business community as well as the governments in coming down and making sure that we all have a common outcome or objective that we want to reach. And one of the core focus should be protecting livelihoods, because as unions, jobs for our members is one of the critical and most important things that we can do. And if that is so going to be paramount, then training and upscaling our workers for the needs of tomorrow then becomes important. And then we need to then identify how we can actually make sure that our workers, public sector workers, are trained and upskilled for new jobs, new roles, so that they can continue having livelihoods. And then that will help us have a value proposition that we can provide for our members. With that, thank you very much.
Okay, thank you very much, Brother Sanjeev, for a very brief and concise presentation on the response, union response and government response, the Singaporean way, I should say. And I think we have seen some of those new ways, and yeah, thank you for sharing that. And yeah, we will try to look at that perspective as well, and maybe some other countries could learn on these things, how unions and government in the as well as the business community in Singapore responded to this pandemic. Okay, so now we will go to this the last presenter for the sharing of the government and union response from the Philippines. And now welcome Brother Abdullani Lakibul from the Confederation of Independent Unions in the Public Sector to share with us the Philippine unions and government response to the pandemic. Dong, you have 10 minutes. Thank you.
Yeah, thank you very much, Sir Ian. Assalamualaikum and good morning to each and everyone. Nice to see you here. Next slide, please. Okay, my presentation is focusing on the Republic Act number 11469, otherwise known as the Bayanihan to Heal as One. This is the response of the government when pandemic, the COVID-19 surged in the Philippines way back March of the current year. So I concentrated on the Section 3 of the Republic Act number 11469, otherwise known as the Bayanihan to Heal as One, particularly of the following provisions. One, mitigate of the immediate contents of the epic COVID-19, then immediate mobilization of assistance, provision of basic necessities to defend families and individuals who are experiencing the effect of the expanded community quarantine. Because since March, I think second weeks of March, we are all in this is national situation, we are all in the expanded community quarantine, wherein all Filipinos have been quarantined. Of course, the government should give them basic services and basic needs for example, their foods, etc., and other basic services that the people needing. So the third one is that undertake parallel measures action as not to overburden the healthcare system. So the healthcare system was given priority. going back on the Republic Act number 11469, this is the law wherein our Congress have acted to give power, special power to the government, to the president, to spend at least 279 billion pesos for any needs of the people. This is the effect of the COVID-19. So the government, the people were given allowances, for example, 6,000 to 8,000 to by the poorest of the poor. Then the senior citizen, the PWD, the solo parent were prioritized on the said assistance. Then undertake parallel measures. Then all needed in the medical needed were purchased, which the system were shortcut. This is to give way to answer the COVID when it comes to health problems. Immediately provision of the adequate health care to personnel under PUI, person under monitoring, more such the individual who were tested positive. So there is the services exclusive for them. All hospitals were ordered that to have priorities those people who are in this situation. Carry out relevant programs intended for recovery affected employees in the dependent and rehabilitation of the small enterprise, wherein the workers here were given also allowance for those who cannot go for work because of the lockdown. Then it is this is the assistance, we call it the CAM, the compensation allowance, monetary allowance for the workers. Then ensure that there is sufficient, adequate, readily available funds to over the foregoing activities, to funds the mentioned activities, to continue partnership and between government and the private sector, including their stakeholders, come up with a double responsive mitigating measures and the disaster program. So donations and help from individual and private sector were poured. In addition, this is in addition to the government approved funds to answer the COVID-19. Enjoin all parties in the continuous promotion of the protection of the collective interests of all Filipinos during the challenges. The same law accorded the President authority to undertake the necessary action. So if we can see that the all hands of the individual and the government were put together just to respond to this pandemic. But of course, we cannot set aside the implementation of that. There is this question that why people were not given all with the same benefits when in fact they are qualified, no? So the government set this aside, but instead just continue assessing the person who are really in need of help. That's why, although this Bayanihan Act was ended on June 25, there is this move that the government, the Congress should convene immediately to continue this, we call it Bayanihan Act 2, to implement the other unimplemented programs relative to the Section 3 of the said law. Next, please. Next slide. Okay, this is our comment on the Philippine government's report when it comes to the figure, when it comes to the implemented of all projects. This is our comment. I would like to give credits our partner in the Learn Education and Research Network, our researcher who did this. So in the interest of time, I will not be reading this one because in the way the document is there, then I will be sending the narrative in the form of Word format because the source were indicated in the search document. But instead, may I please proceed to the succeeding slides, which contains the workers' call. Okay, next please. Next please. Next please. Okay, let's listen to workers. This is go back. Go back, please. Yeah, listen to workers. This is the general call. This is encompassing to all sectors, both private, formal, informal, and public sector to the government. Economic recovery is too important to be left to the hands of Secretary Dominguez. This is our DTI this is one of our secretary in the economic team only. The government always talk about whole of nation approach in addressing the pandemic and its consequences yet ironically continues to disregard workers' voice. We have already seen how government's dismissal of public calls on how to handle the pandemic better has led to disappointing results in controlling the spread of the disease and securing the welfare of the people. Government bureaucrats do not have monopoly over knowledge. It is now the time for the state to listen to its people. So that is the general call of encompassing to all sectors. But the next slide will be dealing with the public sector's respond, particularly on our engagement with the offices of the government that serving the public sector and other, particularly in the health. So our workers' initiative response, for example, full implementation of the joint memorandum circular. I'm sorry, I was not able to put the agency, which is the civil service, the Department of Budget and Management, the DBM, and the Department of Health. Which is the occupational safety and health, wherein it is very lauded and bolded the implementation of the occupational safety and health following the protocol standards set by the DOH in the workplace. That includes benefits of the workers who are engaging into the frontliner and other sectors, because in our definition, as a labor definition, our frontliner not only dealing with the health workers, but it also includes our our security guards, our janitorial services, whatever that is complementary to the implementation of the first responders movers. Then this is now very, very fresh to the public sector, the occupational safety and health. That's why we would like to adopt the version of the private sector wherein there is in the monitoring of the said law. Then how to assist us in our local is that we are mapping out who are those workers who have their occupational safety and health provisions in the collective negotiation agreement. If not, then we ask them to include it, and we help educating the leaders on what is the importance of this GMC 01/2020. Then the second, the compliance of the Civil Service Memorandum Circular number 10. This is the protocols wherein is stated, because we are now in GCQ, how many workforce will be reporting to the respective office, what are the protocols, and what are the guidelines should the government workers will allowed to or will be asked to report in the respective work. So we monitoring all public workers to ensure that the said compliance in Civil Service Memorandum 10 is followed. Number 3, bayanihan sa manggagawa ng pamahalaan para sa mamamayan. November 16, there is this is headed by the Civil Service Commission with a representative of the workers from 4 sectors, the NGAs, the LGUs, the NGS, and GOCCs, wherein some of the PSI affiliates were having its seat there in the PSLMC. What does it mean? The bayanihan na magagawa sa pamahalaan para sa mamamayan. We ask the civil service to send at least to issue guidance to issue announcement that all government workers should contribute at least minimum of 50 pesos from their monthly salary, and from July to December, because this is to respond in the initiatives on the government's initiative. We propose it because this is to see the government that the public sector is not just working on our beneficiaries, but we have also this mind on how to help the government. So should this resolution be approved, I ask the approval of the NCC. We will be calling a meeting for the implementation of the matter. So thank you very much. That is for the public sector of the Philippines, PSI affiliate.
Thank you, Brother Dong Lakibul of CIU, and you have expressed or you have shared with us some of the workers' response and calls to government during this pandemic. Yeah, I think there are some important things that we have to learn from it. Though still now the Philippines is struggling, and we are still increasing, but I think there should be a better learning on this experience, and we can move forward from this pandemic and act accordingly. No? And unions should play an important role. So it's now around 11:40, and I think we should go ahead. We still have 3 more, but as of the moment, we will be hearing from the PSI AP Regional Secretary, Sister Kate, to speak on the COVID-19 recovery and building. Kate, please.
Thanks, Ian, and good to see you all virtually, comrades. I was actually planning to spend July and August in Southeast Asia, was my original plan, and partly, and also to take my kids back to Thailand and be based there, and so really missing both seeing affiliates and, to be honest, the nice warm weather. But it's really a good opportunity to hear from you all and hear about what you've been doing in each of your unions and countries. I'm going to focus a bit more on how PSI sees the need to change systems in order to build a recovery that's both gives us the opportunity to respond better to crises in the future, both public health crises and other crises, as well as to ensure that we uphold decent work and labour standards and build back jobs. So let me see if I can share a screen and I hope that I should be sharing the screen now. Basically, I think when we look at what's happened, the challenges that countries are having, and some of the challenges that some of you have already presented, are often to do with the kind of rules and systems that PSI has raised concerns about over the last decades. The rules that give more power to global capital than to workers, and that restrict the capacity of governments to really provide quality public services, to ensure regulations, and to bring supply into their own country. So basically, I think what we need to do is, and PSI's work, is looking at both the immediate response, and a lot of what you've presented is around the immediate response, the response that particularly the frontline workers had to provide, and the changes that had to take place to contain the virus and to protect public health, and some of the barriers that we've already found that have existed in doing that. So that is critical to the work that PSI has been doing. But second to that is really how do we reshape the economies and build COVID recovery where unions are at the centre of those plans and working with governments around all of the pillars of our COVID recovery plans, which relate to building quality public health, but also to essentially changing the global and national economic systems so that we can have the opportunity to build back better, as Ian has said. And there's a range, I think, of rules that have already been challenged by a number of governments, perhaps not so many in the region, but in Southeast Asia, but globally, governments are having to do things that would have been a breach of international trade rules, as well as start to plan for preparing for future crises. And so we also know that that's going to cost a lot of money, and so we need to change some of the global financial rules that will allow us to do that. And lastly, whilst I don't have time to go through a lot of this, but we need, as the union movement, to be on alert for what is increasingly the opportunism of global corporations to profit from the corona crisis, And I think we cannot build back better unless we are aware of what the alternatives are. There is nothing inevitable about what's going to come. We know there will be change, as has been said. There is definitely going to be change, as every crisis brings opportunities to change. It brings opportunities for us to reshape both the political and the economic systems, but it also brings opportunities for others who have increasingly more power and resources to reshape the way that the world works. And I think at the moment, there's possibly more going on to reshape the world in a way that advantages large corporations, particularly large tech corporations, than there is in terms of reshaping in a way that will be more beneficial and address the fundamental problems of inequalities, but also of the erosion of public services. So we've started to think about what COVID recovery plans should be, and I really encourage every union and every national, all of our NCCs to start to think about how you can influence COVID recovery plans. And we want to see those plans have an ambitious aim. And these 4 aims, I think, should be part of any COVID recovery plan. Let's not limit ourselves only to immediate issues of, returning jobs to those that have lost, or ensuring adequate health. That is core. They are the first 2. But we also need to look at what else it will deliver, and that includes to decarbonise economies, but really more importantly, broadly, to have the opportunity that we have always been advocating for a better, more equitable society that is able to look after everybody. So when we say the first objective there is to ensure all people can receive the help and the care they receive, that's all forms of care, and we're not just talking about the crisis response care, but that we can shape an economy that actually, and a society that is capable of care, which we've seen hasn't been the case in many countries. I should say, though, that I think the countries that have done the best have been those that have had a very active union movement, both shaping responses, but also stopping and whistleblowing on the most dangerous practices. When unions in hospitals, for example, have alerted authorities to the lack of PPE and demanded it, it's not just for the workers, but for the public health system that there's been large advantages. And I think eventually we should start tracking where unions have really saved the public health system and demonstrate that part of a crisis response is a strong union movement. So, of course, we've seen as well that whilst a number of countries have, it hasn't been easy to predict who was going to have the worst, especially as it started in Asia, of course, as we heard from Thailand. Thailand was one of the first countries to experience cases outside of China, but very quickly responded, whereas Europe, of course, had far greater outbreaks in that time. But what we have seen is that economically, everybody's suffering. It hasn't really mattered if you've had a smaller crisis like Thailand. They still have an economic crisis because, everybody's had to shut their borders and shut down parts of the economy. But the countries who are faring better already are those who have large public sectors as part of their broader economy, whose public sector is more than 50%, which is, a lot of European countries, Japan, a lot of countries who have a larger public sector don't see the economic disasters that perhaps other countries will, because all of that part of your economy can keep going. And also that it's much easier to expand once you already have an established, strong public system. It's easy to offer new positions and have the fundamental structures for an expansion of public employment as employment generators until, you know, there are other opportunities in the private sector. So a very clear way that can be, that some of that employment needs to be directed is obviously in public health. And PSI has already been working extensively with the World Health Organization and the ILO on drawing attention to the fact that all before the crisis, we'd already identified that the world needed at least 18 million additional health workers by 2030, and with the largest numbers in Asia. And that obviously this crisis has shown us that would have been, even that would not have given us the real preparedness for the pandemic, because we also need a range of workers in other health-related areas like health research, and in areas that perhaps haven't been, that have often been in the private sector, but we can see should be in the public sector. One of them is in aged care, which isn't as prevalent in some parts of Southeast Asia. Maybe Singapore has, you know, increasingly Malaysia, but I think in the future will be bigger and bigger. Thailand, for example, is projected to have, you know, an ageing population. So what we've found is aged care has been a disaster where it's privatised. In most of the world, it is privatised, and that has been a disaster in this pandemic. So one of the things PSI wants to drive is to have a public aged care system. Similarly, childcare should be public, and that we need other community health sector, for example, that is often informal sector, should be formalised and in the public system. And similarly, we need far greater public education and training and research for a public health workforce. We've seen in some countries a recognition that there needs to be more health workers, but not a recognition that there needs to be more investment in training the future of health workers, and often leaving that to the private sector, which again doesn't focus on training that is really needed in the country, doesn't focus on the kind of skills for a public health system, but often focuses instead on the skills that a private health system needs. And then the new public goods and every other crisis where globally where countries have come together to respond to a crisis and done it effectively, they've done it through agreeing to large-scale public investment in public goods, many of which we still have. So for example, here in Australia, many of the most valued public goods came after crises, whether it be a new public health system or large-scale universities. All of our water and energy was built as employment schemes after either the Depression or the First or Second World War. We even have some beautiful public pools, for example, in the ocean, that were all employment schemes that were government-run, public, when there was a crisis. Similarly, transport, new trains and so forth were all built at that time. Many of them have been privatised, but of course they were public. They were part of recovery plans from other disasters. Of course, that takes money, and one thing we need to be clear on is that there is money. There is money. It's just that it's going to the wrong place. I had another graph here, which I think I've taken out, but that shows that the amount of money that went into bailing out the banks after the financial crisis is more than all the money that governments have collected from privatising public goods. So for the last 20, 30 years, when governments have been told by the World Bank they need money, therefore privatise their public services, could have been covered by the same amount of money that was spent bailing out the banks. We do not want private sector bailouts, to get out of this recovery. We need public sector investment. And there's a number of ways to do that. Of course, one is tax options. I've listed them there. I won't go through each of them, but we will be running campaigns on some of those taxes. And what I want to say to our affiliates is any opportunities you see for us to help you campaign on taxes, and including when governments have inquiries into the potential for new taxes. I know that the Philippines, for example, is having an possible inquiry into digital tax. We would like to support you, and so any opportunities you see there, please let us know. Also, a number of countries, sorry, somebody's coughing and I can hear it, if you could mute, please. A number of countries have said that they will not allow any companies to receive any money that relates to the COVID recovery or to provide any services for government procurement if they are using tax havens or if they don't report on their tax on a public country-by-country reporting. And I think every country should be doing that. We cannot be using public funds to go into tax havens. And that's a really good, simple demand that unions can be making now to their governments. There's also a range of other subsidies, and you'll see this example here as the graphic showing how much a mining subsidy could be used to fund a whole range of important public services. So all the mining subsidies could fund, 4 hospitals, the number of nurses, etc. And I think those kind of graphics are what we need in our campaigns to show that we do have money, governments do have money, but they're going to the wrong place. We also, as you know, PSI has been campaigning for around changing trade rules, stopping new trade agreements. And we set up in this region Unions for Trade Justice. Many of you have been instrumental in that campaign. And this just shows how right we are, because all of the trade rules that we have been campaigning on are illustrated by this crisis as being rules that undermine public capacity to respond. The obvious ones are obviously in medicine and technology. Where sorry, Willie, I can hear you.
Please mute.
So all of those trade rules that we have all been campaigning on are illustrated here. Just a couple that I'll quickly mention. Medicines, for example, you can see right now we have a crisis where some countries will monopolise medicines, and some companies, of course, because we have globally privatised the manufacture of medicines and vaccines, and some companies are profiteering. Instead of these trade rules that tell us that we have to respect intellectual property beyond, any reasonable level, we should have a global agreement on the sharing of medicines and the sharing of vaccines, and that's PSI has been campaigning for that. Another one that's very clear here is that governments need the capacity to take over private goods when required, like hospitals, like airlines, like manufacturing, when there's a crisis, and many countries have done that. Now, while trade unions have been running webinars like this, law firms in Europe have been running webinars on running the ISDS cases, the investor state dispute settlement cases. They have been running webinars on what the COVID recovery means for companies' ability to sue governments, because there's a lot of money to be made in suing governments. And so we know that there's likely to be, unless we campaign against them, shame the companies that are doing it, force governments to take action, there will be cases where governments are sued for not just millions, but billions of dollars. So that's another part of the COVID recovery. We need to suspend all trade negotiations. We need governments to suspend the obligations they have in trade agreements and renegotiate them with everything we've learned from COVID. And another area that we've been campaigning on, very much related, is in relation to debt. The level of sovereign debt that governments have that could undermine their capacity to respond to COVID. We need governments to actually use debt if they need to. They should be able to use debt right now to invest in the public without the fear of having demands from the World Bank or from the IMF or from private sector in relation to the repayment. We need to suspend current debt obligations from developing countries and renegotiate those, and particularly any countries in crisis, debt crisis, not so many in Southeast Asia, but could be. So we need to have a global debt workout mechanism that is fair. And PSI has put out a number of briefers. It shows you that after the Second World War, the mechanisms that were put in place to deal with Germany's debt were all designed for it to recover and build and have a effective economy that could employ people and build up a strong state. And that's what it did. And we could apply those kind of rules to the current debt arrangements. And I won't go through them anymore, but anything that, any of these areas that I've touched on, if affiliates would like, we can run more concentrated webinars just on those topics, or when you have CSRAC, we can go further in. It would be useful to know which one of these is most interesting. So that's really the very quick snapshot of, I think, how we see recovery. I think there's a lot more to discuss about that. And on Wednesday, I'll be speaking on a webinar that the ITUC and FES is running in the region, more about this COVID recovery, and hopefully some of you can join. But again, I really encourage you to think about how PSI can support you in your national campaigning for COVID recoveries. Finally, I just wanted to finish with this image, the touch one, touch all, which is a union phrase. And I think it's never been clearer than now that if anyone is undermined, if any public health system isn't working, if any workers, as we heard in Singapore and other places, are exposed, migrant workers not having the chance to have social distancing or PPE, if anyone is exposed, we are all exposed. So our best defence is to build our public services and build our solidarity and rebuild capacity for the whole region and each country to care. Thank you.
Okay, thank you very much, Kate. I think you have shared with us how PSI look at the recovery and then prerequisite to recovery and rebuilding. And one of those is really why government should spend in public services. Okay, Kate, thank you very much for that. But before I go on, I would like to get the consensus of all. If there's no violent reaction, that we can just extend at least 12:30 to have this full webinar. Is there any? Can we go ahead and proceed?
Yes.
Thumbs up. Okay, that's good. So now we'll go to the next resource person. I think there will be two, and it would be between Sister Diane of ILO Manila and the workers from ILO Actrav, Brother Samit Dasa, for the presentation of ILO in the Back to Better Normal. So Diane and Samita, please go ahead.
Yeah, hi Ian. Just give me a second to share my screen.
Yeah, please.
Okay, thank you so much. So the presentation, first of all, good morning to all brothers and sisters in the region. The presentation will be made by both me and Diane, and it touches greatly upon what has been discussed by the brothers and sisters so far. Particularly, I think it tallies very well with what Brother Sanjeev has been pointing out on the challenges and the upcoming trends, and also what Sister Kate has been on the major challenges which are going to come up as well. So our presentation on road to a better normal law for the public sector workers, we would like to start with what we would like to focus on. We would like to focus on the pre-COVID trade union situation, because if you don't understand what was our situation before and what's happening because of the pandemic, and then we want to move into the general strategy and then talk about the ways forward, etc. Predominantly on what the brothers and sisters have been talking about, etc. On this concept of the better normal, new normal, etc. I think one of the articles that you all should look at is something by Guy Ryder, the ILO Director General, who did an op-ed in the ILO. You can find it in the ILO website. Who pointed out, I mean, the term better normal came around in the 2008-2009 financial crisis period. But we resumed back to business as usual after the crisis. There was no better normal. So at least this time around, let's try to make it a better normal is what the DG was saying. And I think he points out a very crucial factors into why it should be pursued by all, because you do need some changes in the systemic processes, because without that, these systemic problems are going to persist and it's going to create more problems. So I encourage brothers and sisters to read this article as well. From the ACTRAF side, we had another study, and I can forward that to you all. Maybe you all have seen it. It's called Trade Unions in the Balance. And in that, it analyzed the situation as to where the trade unions were heading by the time we did the study. There was no pandemic, there was no even an inkling of a pandemic. So, the situation was, where was the trade unions going? And one of the things is the study pointed out 4 key scenarios emerging out. The first being gradual marginalization. These scenarios were based on something, the union density. Now, while union density calculations might differ from country to country, it might have different definitions, but the overall effect we can see, which is actually was happening at the time before the crisis as well. We saw gradual marginalization where the densities were decreasing. The unions were considered less powerful, less relevant, and especially in new and emerging labor markets, the penetration of the unions was far less. And also, you could also see that the relentless process of liberalization and freeing of capital for its dependence from labor was pushing these processes, marginalizing the unions into far corners where it was centralized primarily in the public sector or in larger corporate entities, where the larger supply chains were, etc. New organizing was not happening, etc. And a push factor of this, the repercussion was that we began to see a larger fragmentation happening, particularly in the public sector unions. There was defragmentation happening. Various groups were sorting out themselves. We also saw that happening in other areas as well. So, which pushes, because everybody is competing for scarce resources or membership, etc., on the gradual membership. One of the concerns in the gradual marginalization is the study points out that if you have something like 10% of union density and it goes further down, let's say 5%, and then to 2%, etc., the trend becomes irreversible towards 2%, etc. So the chances of unions becoming relevant, more powerful, and back to that original state of where they were a meaningful organization becomes a bit hard once it gets to about 2% numbers. Then we also saw, and we continue to see, the dualization of union representation and its policies. Rather than a rapid gradual deterioration of or marginalization of the unions, we see unions will have to defend their positions from where the key memberships are, either from the public sector point of view, government sector, etc., where the majority of the unions are concentrated, where the sector unions are predominantly holding much greater power. But it also means that certain other groups who would not have that sectoral representation would be having faster deterioration of the situation. And under these conditions, we see that there is increased instability of work arising out of it, which means there is a sharper distinction between unionized and non-unionized firms, small and larger. And the larger would have a greater number of unionizations, while the smaller groups or the medium-sized ones would not have that thing. So dualization of union representation, which takes away the power from the unions, is a critical situation that we were seeing pre-COVID. The third scenario, which is also projected to come out, was replacement, where unions will be gradually give away to social action and representation based on legislation, for example, minimum wage boards, wage guarantees, wage panels, works councils, productive boards, arbitration and review boards. That takes the traditional role of the unions in bargaining, that takes in the policy making, in the submissions, etc., takes the unions' role away. Employees' initiatives, for example, employee involvement, ethical codes, or what we call codes of conduct, participation and sharing models, which all takes away that union's bargaining position, negotiation position, and trying to make better effect. And the business models, as Sister Kate mentioned, we see more and more law firms coming in, intermediating labor agencies and consultants, putting less or more spontaneous forms of, creating a sort of additional models that undermine the role of the unions, thus replacing it other forms. So the fourth scenario is the revitalization, where unions find ways to strengthen existing practices of trade union renewal, reverse the current trends, and then try to find a regenerative method of getting back to where they were. Now that's where we start, where we stopped last, and then the pandemic happened, sort of. And then when we look at what has the COVID scenario done to these things, so what we see is that the job losses is the overall, if you look at the numbers in the study, the overall membership stood at around 10%, or less than 10%, or averaging approximately 10% for the Asia Pacific region. What we see is with the major job losses, either temporary or permanent, we see the core union memberships being hurt. And it's definitely impacting union operations and the union strength, etc. So we see the potential going downwards because we are seeing more unemployment emerging as opposed to more employment emerging till this crisis comes into some amicable situation, etc. As our last study says, working hours are greatly affected, people's incomes are greatly affected. Thus, that ability to coordinate, collaborate, and organize is somewhat at a standstill situation where working hours are substandard, or you're underworking, or you don't have full working hours, etc. So the baseline scenario was predicted from the last report was 4.9, a loss of 4.9% of job working hours. The pessimistic scenario was, I think, 11.9 minus, which was about 200 million people still having less working hours affected, full-time hours were affected. and a baseline, an optimistic trend based on whether the countries are fast recovering, whether certain sectors are fast recovering, maybe minus 1.2, where it's about somewhere ranging somewhere between 21 to 80 million people who would be without jobs, etc. It's still a bad situation. 21 to 20 million people losing or having less hours of working means a bad scenario altogether. A major concern is on the 40% of these affected people or hard hit sectors, etc. 40% of the population is women. And these women workers are predominantly in sectors where, for example, health, primary health care, education, etc., which is also having a drastic hit on how women's employment conditions, etc., are challenged greatly in this. We also see that there is increase in violence against women in the certain numbers in certain countries, etc., which is also discouraging or making it much more harder for women workers to get on board. The other affected groups, which I've not mentioned in the slide, are youth who are also being completely left out of the process, and the informal sector. So right now, I think our colleagues would be looking at how the informal might grow or how the other sectors might be affected based on all these scenarios, etc. So we can see that the preconditions of marginalization, dualization, revitalization, and probable scenarios of the first bad three scenarios, marginalization, dualization, and replacement, based on the COVID scenario, has increased. So if we are going to go back to a better normal, I think the unions would need to push more on that aspect of, rightly said by Brother Sanjeev and Sister Kate, of being at the table and pushing the agenda very strongly and together. I think without that, I think even the other country representatives from Philippines, Thailand, Malaysia, Indonesia, I think all these brothers and sisters are highlighting the critical importance of pushing and being at the table and pushing for those policies which are critical to have the trade union voice. It's not just to sustain the organization, but it is the right thing to do by the people who would be otherwise left out of the process, where a lot of people will be left out in moving forward. And now at this stage, I would like to call Sister Diane to talk about what the ILO calls the 4 pillars, getting back to the better normal. Diane?
Thank you, Ravi. And I would like to again thank you for inviting the ILO to be part of this very important webinar covering the public sector. This is based on the policy framework that was issued by the ILO in May 2020. We'll share with you that entire document. But this one slide actually captures the 4 key pillars that covers the general and proposed framework. And just to say that international labor standards and decent work results should serve as a foundation towards a better normal. So all these 4 key pillars are integrated and mutually reinforcing each other. So for pillar 1, stimulating the economy and employment, this covers both short and long-term strategies, and these strategies should be very much informed by assessments. So fiscal and monetary policy should go hand in hand. This will address, for example, prevention of bankruptcy and closure of enterprises, especially the small and medium enterprises, and importantly, to keep the jobs currently occupied by the workers. And it also talks about public investments. So it can look at care work, environmental restoration, and community infrastructure. Just to say that both the long-term and short-term strategies towards recovery should cover both the public and private sectors, and to reemphasize that it should be based on decent work and international labor standards. So what I'm just trying to discuss would be the summary of all these pillars, and we'll send you the key documents. It can also look at sectoral policies, for example, investments in the health sector, care sectors, including other frontline services, which would tend to expand during the pandemic. So for Pillar 2 focuses on generally enterprise level, and again, ensuring that jobs are maintained and incomes are maintained by workers. So it means that it's an opportunity to further enhance the social protection, the coverage, as well as the benefits. It may also, of course, provide financial, tax, and other relief for enterprises, but here we should focus on the small and medium enterprises that are particularly vulnerable. For Pillar 3, so Pillar 2 also may include various types of relief. So it can be financial and tax relief for the enterprises, the small, medium enterprises, implementation of employment retention measures, and other workplace level measures. For Pillar 3 would focus on protecting workers in the workplace. So to strengthen the occupational safety and health, particularly implementing the measures at the enterprise level, the OSH protocols, to adopt safe work environments, including flexible work arrangements. Here we are increasingly looking at work from home arrangements. And other flexible work arrangements that may be discussed at the enterprise or workplace levels when it comes to the public sector. So social dialogue is very key, so which is under Pillar 4. So all these are mutually reinforcing. What we're seeing is that if we, under Pillar 1, if we do all the economic stimulus, but then we're not observing the occupational safety and health protocols, then all that stimulus will not be very effective, because the work environment remains unsafe and people get infected, and then it becomes a whole cycle where the business would again have to be closed and lockdowns reinforced, etc. For Pillar 4, of course, reliance on social dialogue is very much important to increase the capacity of the employers as well. Here, I'll focus on increasing the capacity of workers. For the employers, I think it's their contribution to availability of funds, responsible business conduct, etc. And this mainly refers to the private sector employers. But for the workers, for example, increased capacity for advocating policy proposals, influencing national policy at the national level, and there are also opportunity for the workers through collective bargaining measures at the workplace level to protect the members, to mitigate the negative effects, and to also discuss workplace protocols or occupational safety and health measures. What can be done by workers especially is to provide guidance and information to their members. This may include also OSH measures, hygiene, workers' rights, that's very important, and obligations, and promoting access to social benefits. Another important area for the workers' organizations and trade unions is to, while you have existing service, it is an opportunity to also come up with new and expanded services to cope with the pandemic as well as this crisis, and including expanding membership, especially those that are generally unrepresented, including those that are under non-standard forms of employment relationship, as well as in the informal economy. So it's an opportunity for expanding the scope of membership. What is important as well under a new normal is for the trade unions to increasingly engage in the UN system, because we need to promote the visibility of trade unions in the UN system, because there's a lot of what is important in addressing the pandemic is to promote also international collaboration, and other UN agencies are also addressing the pandemic as well. And it's very important for the trade unions to promote their visibility as well as the visibility of workers' concerns. I will stop here and bring the microphone back to Ravi.
Thanks, Diane. Okay, based on what Diane was talking, if you expand a little bit, I think the key challenges ahead and the critical matters for further trade union dialogue would be and these points are taken off from our last COVID monitor report. The first point is on finding the right balance and the sequence of health, economic, and social policy interventions to produce optimal and sustainable labor market outcomes. Now, I think this we also need to look at from the perspective of whatever was previously there between public and private, or that the private sector should be the lead, etc. All those stories, the fundamental assumptions comes into question at this moment, and I think the unions need to highlight that fact or take that into consideration, where the right balance of public and private actors coming together to make the economy whole is vitally important. And how sequencing, like Diane said, if we do have the wrong sequencing, if you push people to just rush off to the factories and work environments without putting the right protections, we're going to the chances of a second scenario emerging is very high. So I think the right balance of having public and private partnership, the operations needs to be looked at. The right investments going into the public sector, like Sister Kate was mentioning, is vitally important as well, because the assumption that otherwise the private sector would be handling is now, again, the key assumptions are in question based on this pandemic. So the scenario is, okay, it might not be the scenario next time around. We cannot make that assumption. We will have to account for the fact we are in this current situation because we ignored those synergies between the public sector and the private sector and how that is supposed to be modeling. So I would say that the private sector, the public sector unions have a great deal to work with the public sector, the private sector union federations in negotiating and submitting key concerns of the union movement, and not as a sectoral submission alone, but for together to submit policies for dialogue. It's very important. And from the ILO side, from the ACTRAB side, this is one of the key objectives, outcomes that we are pursuing in this biennium and into the future. Coordinating and working with the private sector unions, I would say, is critical. I don't think we can solve this, the current situation as a public sector problem or a sector problem. I think both sides needs to come together much more and dialogue on the common issues at a national level, at a regional level, as to how policies needs to come together. The second point is implementing and sustaining policy interventions on the necessary scale at a time when resources are increasingly constrained. Now, this is where I think it goes back into a greater debate, and I don't want to stress too much time, but I think Sister Kate put in some seriously superb concern as to something which is vitally important, which is debt. The debt and how international solidarity is working and how funding is happening at the current levels of how this problem is being resolved. We see that high-income countries are having their own strategy. They are deploying money, etc., while medium and low-income countries might not necessarily, or in proportion, putting in educate. They might not have the capacity to put in monies to recover the economies, etc., which leads to debt problems, which leads to further economic volatilities that might come out very strongly, and it needs to be looked at from both the public and the private sector. Again, unions working together to submit policies which is amicable, because if not, the debt situation might also mean at times stringent fiscal policy measures that might need to be implemented in certain countries, which might technically mean the public much more strain on the public sector unions, where job cuts on the online, or where patterns of job diversifications might be online. I think Brother Sanjeev touched upon it a lot, but I think the critical factors of how debt is managed and how revenue is managed, I think was very well touched upon by, and the key concerns around that was touched upon by Sister Kate. And I don't want to spend too much time on it, but I think it's a very vital factor for the union movement to consider as a group, and not just on a sectoral approach. Then supporting vulnerable and hard-hit groups, generating fairer labor market outcomes. Again, as our studies are showing, the greatly impacted people are women, informal sector, and the youth. Now, when we look at this, and I think, again, I want to move back to something Brother Sanjeev was saying, the whole organizing strategy. I mean, the way we give out membership services, the way we retain membership would need to be relooked at. We might not be able to do business as usual, because business as usual has decreased our memberships at times. We've not been growing as where we should have been growing. So we might need to rethink of our organizing strategies. Maybe we need to deploy social network working as an option for organizing greater collaboration and options. But then how do we ensure equality? How do we ensure social dialogue? And all these things, other things that we need to critically think as a labor movement is of primary concern. So increased membership services, again, is an active priority for this 2 years, including next year. So we would like to work with the union movement as a whole without making a distinction, because it's a common problem for both the private and the public sector. And I think the potentially changing patterns of job descriptions, etc., which is going to be a key concern, which is going to come up based on the new platforms and work modalities which are emerging. The definitions of how a worker is defined, how the employment relationship is going to be a critical topic for the union movement, and how the union movement can organize more people to come together, how to function and how to socially network and how to move forward as an organization. I think these are critical questions that we as the union movement would need to consider on all these things. Another problem that we've seen, and I think Diane touched on it a lot, which is the coordination of information. We see that various groups are holding information, pockets of information. Sometimes it is shared in open forums like this, sometimes it is not shared. But what is also happening is sometimes the general public is not aware as to, or the general workers are not aware as to where do I get my unemployment insurance? How do I get it? What forms do I fill in? Where do I go to, etc. I mean, we've seen these process breakdowns in certain other countries. And what the union movement in those places, what they've started to work out is to set up or try to set up information hubs where that critical information can be conveyed through the trade unions. Also, acting as a beacon for the workers and the people to line up or to align themselves with. My last 2 points would be, again, I think this is a topic that has been greatly emphasized by all the brothers and sisters in the discussion, securing international solidarity and support, especially for emerging and developing countries. Like we discussed, debt is going to be one of the key critical factors which might be hitting the emerging and developing countries, and how the adequate or the correct policies are put in place. I think some superb points were highlighted by Sister Kate on these things, aspects that needs to be looked at and how to move forward. And lastly, but rightly, the most important is strengthening social dialogue and the respect for rights. What we see is further deterioration, where we see active labor market policies being introduced or being recommended by certain groups as labor reforms, which is disconcerting because it might actually fundamentally attack the fundamental rights of the workers, and also further deteriorate the capacity to organize, hence further deteriorating social dialogue overall. So I think as a union movement, I think the sister or the brother who was talking about the Indonesian situation was highlighting this greater need, and we see it in other countries as well. So I think this is a time where we cannot anymore take on a sectoral approach alone, but I think this is the correct way to move ahead, where all sectors come together much as possible and try to coordinate. I think it calls for a national joint action from the union movement rather than a sectoral approach alone, because it's doubtful that a sectoral approach alone might solve the problem. So with that, I would like to say thank you from both me and Diane, and hopefully we can support you all in the discussions as going forward. Thank you.
Okay, thank you very much, Bro Ravi and Sister Diane from ILO. You have touched on many issues and provide some sort of context and perspective with regards to the COVID-19 and how to be look at issues on to consider back to better normal. As we have, we are really late of time, and I'll go directly to. But before that, we can ask question directly to Diane and to Ravi through. I will send them your email, so that you can have at least a better or more discussion through email exchange. Now I'll be going to the last resource person. Thank you, Sister Annie, for waiting. You're hungry and angry, maybe.
Yes.
But I'll give you the floor now for the response to the ILO presentation. Please go ahead.
Yeah. Thank you very much, Ian, and very, very good afternoon to our comrades from the PSI Asia Pacific Southeast Asian sub-region. My both difficult and easy because the previous speakers have spoken and explained adequately the points that I'm about to raise as a reaction to the presentation of the ILO. But let me start by saying that I do share the statement of the ILO Director General Guy Ryder that the pandemic presents unique opportunities and conditions to define, shape, reshape, and advocate for new and better normal for the public sector, for the workers, and for our communities. Now, the ILO also presented the pre-COVID scenario of the trade union movement. And, well, let us be reminded, however painful that those scenarios were the outcomes of decades-long neoliberal agenda and profit-driven free market. So our response should be to take the lessons of those failed strategies response and to totally discard the capitalist response to the pandemic because it didn't work then in normal times. Why should we think that it will work in the context of the COVID pandemic? So for me, the back to better normal for public sector workers will involve first gaining back public trust. Why did I say that? The COVID-19 pandemic put the big spotlight to the public sector, to the different levels of governance, community, local, regional, and national. So the pandemic also laid bare to the public governance system both strengths and weaknesses. It also exposed the serious gaps in the sufficiency in terms of resources and responses, the efficiency and delays of the action that, as you know, exacted tolls on who and how many lives and who and how many dies, whether they are health workers or patients. So it also reveals the access, the level of access, affordability, and capacities not only of healthcare facilities, but also other social health determinants. So most government, with the exception of New Zealand, Vietnam, Thailand, Malaysia, and Singapore, as you know, have been heavily criticized, and the public trust and confidence greatly diminished by how each government responded and dealt the COVID-19 pandemic. And this is not all because of the leadership, but because there are preconditions that made the different governments, the public sector in general, to respond in different capacities. So we have seen how the vulnerable and socially excluded felt abandoned and left unaided by government. So this is the reason why gaining public trust first is in my list if the public sector is to go back to better normal. The ILO also presented the 4 pillars, namely stimulating the economy, the employment, supporting enterprises, jobs and income, and protecting the workers in the workplace, and relying on social dialogue for solution. So unlike the public sector, and unlike the business and capital, which are now repurposing their operation in order to produce goods and services, ensuring that there is also returns of profit, the values, the goals and objectives, and the principles of the trade union needs no repurposing. In fact, the pandemic highlight that our values and our goals and objectives have never been most relevant, as you know, as highlighted by the pandemic. So the pandemic has taught us already important lessons. The pandemic created, in fact, the strongest justification and practical ways to restore people's faith in the public sector. The pandemic also gave us compelling reasons for government to prioritize national development over globalization, fair trade over free trade, renationalization or remunicipalization of utilities, of services over privatization, subsidies over free market, green over brown economy, and strong public sector over minimization of government. Earlier, a lot of substantial points was expounded by Kate. And I'm talking about progressive over regressive taxation in order to fund public services, decent work for workers over diminution of pay and working condition, secure jobs over contractual and precarious work arrangement, ensuring health and safety of workers over taking chances in the name of profit and cost cutting, increasing the capacity of health and social services delivery system over reliance to corporate or private service providers. A pro-people stimulus. Now it has become a, everywhere the call for stimulus, rescue package. But I think we should advocate for pro-people package over corporate bailouts, and investing on research and development over unreliable quick fix solutions. In the context of the Philippines, back to better normal for public sector means adequate funding for public services. And it should be generated from progressive tax. It means we need to stop romanticizing the government and the sector, romanticizing health workers by calling them heroes and not being prepared to provide them the pay that they deserve, the compensation that they deserve. They should be responding by creating more position for health workers, hiring regular or secured jobs for health workers and frontliners, and abandoning the use of volunteers. It means also renationalizing devolved health and social services and lifting the personal cap in the local government. This is very, very much in the context of the Philippines, lifting the personal cap to local governments to allow them to recruit the needed human resources. It also means making the internal revenue allotment for local governments units equitable. For me, better new normal means revitalizing social dialogue and upholding workers' rights. I think the ILO expert here, resource person, reiterated and heightened that call for strengthening social dialogue. Better new normal also means upholding checks and balances instead of suspending them and putting them aside. I think Kate mentioned about whistleblowers, exposing corruption in terms of PPE, procurement of PPEs. And here in the Philippines, the check and balances were really set aside in the name of the emergency situation that we are in through the Bayanihan Act. So back to better normal means also respecting merits and fitness for civil servants over the increasing militarization of the bureaucracy in the Philippines. I think at the helm of the interagency task force are all ex-military or retired generals, and it's not being sort of orchestrated or coordinated on top by health expert. So for my last points, I think that in general, back to better normal to public sector means upholding civil, economic, political, and cultural rights of the people. So that's all I have to say. I can say more, but I'll stop here. People are hungry, and you are violating the length of what an effective webinar is. So thank you all very much, comrades.
Okay, Sister Annie, thank you for that reaction to the ILO's presentation. In as much as I wanted to give some time for the question and answer, we have already more than over the allotted time. Yeah, I would like to just give a little bit of summary. We have discussed some sort of we heard sharing from the Indonesia and Malaysia and Philippines on the challenges and the issues and concerns. We have learned from them with the sharing of our leaders from the different unions, and also we heard the government and trade union response. And most of them are similar, but it comes in other forms. And I think we heard also from the PSI, the recovery and the rebuilding plan for COVID-19 and its prerequisite how to do recovery with all these things happening. And the ILO have presented some perspective and context, with regards to the back to better normal, road to better normal, is that we have heard the 4 pillars as well, and Sister Annie reacted to that and gave the perspective of the perspective of public sector in terms of the back to better normal. I think overall we have heard and learned from each other in this webinar, and I wish to thank every affiliate members and friends of PSI who participated. We have the highest we log in as around 77 participants, and we thank you. There are 86 who registered and 77 stayed until the last part, and now we are still 67. And we apologize for the delay and the interpretation, but nevertheless, I would like to thank our interpreter, Dina and Nat, for giving us the opportunity and sharing and serving us in this webinar to communicate with our brothers and sisters in Thailand and in Indonesia. So to ILO, to Kate, and to the rest of the NCC chair, Sanjeev, Ani, and the rest of the representative from Southeast Asia, I would like also to thank all the staff, Nico, Inda, Glenn, Victor, Angie, and of course, if the new staff, Unita is here as well. So thank you very much. And We will send you some sort of evaluation through your email. Please help us to make a better webinar next time, and we hope we will cut down some of the topics so that we can focus on, and of course we will do it more specific to some topics next time. Thank you very much and have a good lunch. Bye. Keep safe.